Good morning, everyone. My name is John Effinger, and welcome to Texas Health Institute's COVID-19 in Texas webinar series. I'm Director of E-Learning and Training for Texas Health Institute, and you should be seeing a poll there. So as you see the poll, please be sure to go ahead and complete it. So this gives us a chance to understand who's in the audience. I'm also co-director of Transforward Texas Transgender Health, which is a collaborative between Texas Health Institute and Equality Texas Foundation. Today, we're going to be looking at COVID-19 in Texas, applying a health equity lens to inform COVID-19 response and action in understanding transgender and gender diverse health experiences in Texas. To do a little bit of housekeeping before we introduce our panelists, we are recording this session and it will be made available on our website following this webinar. You should also, should you have questions for our panelists, we ask that you insert these in the Q&A box for discussion towards the end of the session, time permitting. But you can also add them into the chat box as well. And use the chat box if you're experiencing technical difficulties or questions, so that that's going to contact our THI convening teams. We can assist you there at that piece. Texas Health Institute is a nonprofit, nonpartisan public health institute based in Austin, Texas. Our vision is healthy people, healthy communities. Our mission is to advance the health of all. We do this through our three areas of work: producing evidence and ideas, translating and sharing insights for action, and advancing collaborative action. We bring expertise and breadth of focus, including health equity, community health, transgender health, oral health, emergency preparedness, and other topics. COVID-19 has impacted every aspect of our society. I think all of us understand that now. It has laid bare the deep systemic gaps and barriers that continue to exacerbate our inequities. In March of this year, THI shared our commitment in playing our part as the state's nonpartisan public health institute to help inform and guide our state's COVID-19 response and recovery. This series is a foundational part of our commitment. We hope it will help illuminate opportunities for us to work collectively to bridge gaps in response and recovery to ensure that all Texans emerge in health and prosperity. Coinciding with today's webinar, we have also released an issue brief serving as a call to action to address the unequal impact of COVID-19. Our expert panelists will help us understand the magnitude of COVID-19's impact on transgender and gender diverse people in Texas. And with that, I am incredibly proud to be on the panel with Philip Schnars, who is an assistant professor at Dell Medical School, University of Texas at Austin, Emmett Schilling, who is Executive Director of the Transgender Education Network of Texas and represents Equality Texas Foundation and our work on Transforward, and Rocky Lane, Board Chair of Transgender Education Network of Texas. A couple of quick objectives for today first, and then a few definitions. Our goal overall for Transforward is how do we improve transgender and gender diverse lives in Texas. Today we want to describe a little bit about the community, particularly for those of you that don't have a perspective on who the community is. We want to explore the LGBTQI plus COVID-19 and You survey that Philip and his team conducted. We want to highlight key factors driven by COVID-19 pandemic. And we want to identify opportunities to improve lives by reducing the number of suicide attempts and suicide ideation. And Katie, are we to where we can put the poll results up now? And let's see who we have in the so this is terrific. We've got a broad mix of people from different organizations, different types. We've got clinicians. It's really good to see the number of folks that we have from nonprofit organizations. We have people that are researchers and in training organizations. We have 36% of us that identify as in the LGBTQ community plus community. And today we have a lot of folks here for both professional and also professional and both. The interesting piece, and we'll cover this, are transgender and gender diverse people counted in the U.S. Census and American Community Service survey. The answer is no. That's part of the problem that we have for folks that identify as LGBTQ plus. There is no way to count us in terms of either the American Community Survey or even the U.S. Census, and so that's why we use estimates for that. So with that, let's go ahead and move to just a couple of quick definitions for folks. Transgender are people whose gender identity differs significantly from the sex that they were assigned at birth. A trans woman is a person who is assigned male at birth but identifies as female. A trans man is a person that was assigned female at birth and identifies as male. Gender diverse are people who describe their gender identity outside of the binary categories of male or female. And cisgender is a term used to refer to one's gender identity or expression aligning with what they were assigned at birth. And you'll see these on our slides as we go through there, so just a little bit there. And then BIPOC, if you haven't come across this term yet, is Black, Indigenous, and people of color communities. And the emphasis on that really is on Black and Indigenous, which is why that's at the outset, but it includes all people of color communities. A quick snapshot on Texas. Roughly 1 in 150 Texas adults identifies as transgender or gender diverse. That's an estimate based on Williams Institute, and you can see the source there. I think all of us on the panel believe that is a drastic undercount, but because we can't be counted in the census of the American Community Survey, that's what we have at this stage. You can see the age range there on the right side of the slide, and probably one of the most important pieces here is that Hispanic and Latinx account for 54,000, and Black and African America account for 16,800, and other races at 6,500. So the vast majority of trans people in the state of Texas are come from BIPOC communities. One last slide. This is a national estimate from the same folks at Williams Institute. And you can see the vulnerabilities that are related to COVID-19 on your screen. One of the most compelling, I think, aside from things like asthma, diabetes, heart, is fair and poor health. You can see that. You can also see current smoker, and there are reasons for that. We could have a sidebar discussion on why that's important. I think the one that all of us are concerned about is the 587,100 lifetime suicide attempts. We'll talk about this in a little bit more detail later, but suicide attempts and suicide ideation are important issues that we have to figure out how to deal with, not only in the transgender community, but looking at it from a public health standpoint. It really is a public health issue. And with that, we're going to also revert a little bit back to the old days where folks are going to tell me to advance the screen. So we're going to start with Philip. You're up, and you want to talk about the survey.
Sure. Thanks, John. So from May 3rd to July 31st of 2020, we conducted an online survey across Texas in collaboration with a number of organizations that you can see here, as well as individuals who were community members that didn't necessarily belong to an individual organization. We were able to recruit 1,348 individuals. And of those individuals that were recruited, 291, or roughly 20% of those folks identified as transgender or gender diverse folks. Next slide, please. So in terms of the survey, we were really interested in understanding several different things. One being COVID-19 outcomes, but also the social determinants or health inequities that existed in the community during COVID-19. What you can see here is that in terms of socioeconomic challenges, we noted that after shelter in place, so as of March 1st, that 28% of the transgender and gender diverse sample reported that they were unemployed, which was higher than what cisgender folks have been reported. And we noted significant differences in terms of food insecurity and folks who are transgender or gender diverse reporting that they were unable to pay their rent or their mortgage. Next slide, please. In addition to those socioeconomic challenges, we also wanted to look at access to social services or medical services, healthcare services during the COVID-19 pandemic. And across all of these services, what we noted was that transgender individuals reported more difficulty in accessing every single service that we had asked about compared to cisgender individuals. You'll also note on this figure that there is an item about shelter in place. What we were interested in understanding about shelter in place was, were folks having to shelter in place with someone who didn't accept them for being LGBTQ, and how difficult was this for them? And what you'll see here is that it was pretty much the same between cisgender and transgender, but what you don't see in this slide is that individuals who are transgender, more than half reported at least very difficult to extremely difficult, compared to only about a third of cisgender individuals. Next slide. In addition to looking at differences in terms of gender identity, we also wanted to look for differences in terms of race and ethnicity. And what we found was that generally across socioeconomic issues and access to healthcare and social services, that individuals who identified as people of color, so whether they were Latinx or not Latinx, the trend was that those folks had greater difficulty in accessing services or had greater socioeconomic challenges compared to white non-Latinx individuals. Next slide, please. We were also really interested in understanding insurance coverage during a COVID pandemic. And what we found was that overall 15% of the sample, the total sample, currently did not have insurance. And this was compared to, we saw significant differences in terms of gender identity with about 1 in 5 transgender folks reporting that they did not have current health insurance or coverage. Next slide, please. And in addition to wanting to understand the difficulty that folks were having in terms of sheltering in place with someone who didn't accept them, we also wanted to understand violence in the home. And so we asked about 3 different types of people, those being a relationship partner, those being someone else, and those being a family member. And what we noticed in terms of differences across race and ethnicity was that generally individuals who identified as Latinx or as a person of color were more likely to report that they were experiencing violence from a family member or someone else that they lived with during the COVID-19 pandemic compared to white non-Latinx individuals. I think I'm turning it over to Emmett at this point as well.
Thanks, Philip. Along the same lines, we realized that we're seeing patterns in terms of regional differences when it came to isolation. I believe we'll see increased social isolation reflect across the board. However, when it comes to the vast geography of Texas, you have very urban areas and then you have very rural removed areas. And this is obviously going to play a role in how people are accessing healthcare or able to access healthcare, on top of all the other obstacles that we've mentioned so far. Next slide, sorry. We also know that 64.7% of transgender and gender diverse people report moderate to severe anxiety and depression. It's important to note that this is significantly higher compared to cisgender people. We understand that COVID-19 has had an enormous impact on mental health overall for everyone who is dealing with the ongoing pandemic and its effects on their lives and their loved ones and communities. And so we realize that the trans community will most likely mirror that impact, combined with significant increase showing within the trans population based on the trends that we have already uncovered thus far. Next slide. In Texas in 2017, we saw a statewide galvanization of sorts of the entire trans community here in the state of Texas. It was largely due to that people were advocating for their right to use public accommodations here. And with that, we saw loose networks of support created. People were connecting with each other even outside of that time frame, and kind of finding ways to share community virtually. However, in the moment that we're in with the increased pressure of COVID and the fallout there, we are really anticipating that these networks of online support, so to speak, are not going to feel sufficient to most community members, and anticipate that this will also reflect an increase in mental and emotional health issues arising. And last, due to the financial constraints that COVID-19 has now exacerbated within the trans community, we're also anticipating, from our understanding, where people really relied on gig employment due to just various obstacles. And so we are anticipating the path to find financial recovery is going to be incredibly harder for trans people due to lack of just general support, due to lack of being in a secure place as this is occurring to be able to step forward, and just overall lack of resources that we have. And from here, I'm gonna toss it over to Rocky.
Thank you very much. My name's Rocky. My pronouns are he, him, his. I want to talk to y'all about a concept, community perspective, solutions that are based in economic empowerment. As Emmett said, we need solutions that are like this. The pandemic exposed a weakness in our system, and our experiences as patients and clients and community members are filling the gaps of what needs to happen. There's a saying when I was a paramedic working 911 that we would say, which is treat the patient and not the monitor. So a lot of times when I'm sitting in a presentation with a lot of facts, I sometimes forget that there are real people behind this information. And so giving you nuance to what the community is talking about and what they see as solutions is really my job in a lot of this. So I want to first say that advocating for ourselves as trans and gender diverse people in this community is difficult work, and we need support. The brief called for Medicaid expansion, which is supported by a majority of Texans, 64% to be exact. Paying out of pocket for affirming care and exclusions create more systemic barriers. I also have noticed and spoke to a nurse practitioner friend of mine who said that she actually, just as a test to see what her clients were going through and her patients were going through, called the insurance company and asked about exclusions. and was shocked to see that someone tried to talk her out, even though she's not a member of our community, tried to talk her out of asking about that information and gave incorrect information. So her testing the system gave her a humility around this fact that we need access support. Next slide, please. So a big thing that I ask a lot is, what does that look like? Economic empowerment. And something that we hear a lot in our community is nothing about us without us. And that means we should have a hand in developing the solutions that affect us. It looks like a lot of things. Some people kind of have started converting gift cards into stipends and things like that, that expand the potential for each participant or people that are coming in to find themselves getting jobs in new opportunities in different industries. The THI issue brief on uncovering racial inequities calls for a minimum sustainable income. And that's pretty popular with our people. Every Texan, we believe, should have at least a fair minimum income. The example is about 250 of federal poverty level, and every Texan should have access to paid sick leave policies. And with higher rates of unemployment and underemployment, food insufficiency, food deserts, and difficulty paying rent, we are seeing, especially with COVID, a need for us to truly come up with solutions that target those specific issues and barriers. I'm a member of the community that we're talking about. A lot of this data describes my personal experience. And so today I'd love to answer questions from folks when we move into that section about what this is like and these barriers. Next slide, please. 70.6% of people, trans and gender diverse people, have difficulty accessing healthcare. Now, we know that we have over 125,000 trans and gender diverse people in Texas, and some believe that we have over 200,000 people. I believe that number is a little closer to who we have. This is who we know of. Accessing medical healthcare is important for every person. Pre-COVID-19, the U.S. Trans Survey revealed that 38% of trans people did not see a doctor because they could not afford it. Our COVID-19 data shows that, we're still seeing this remarkable number of people not accessing healthcare. So we need to do better. We know that Black and BIPOC bodies are not different, but we see difference in their healthcare outcomes. My whole family distrusts the medical system, and I was the first one to enter into medical industry and to be able to come and speak in these industries about these issues and these barriers. Trans people share information culturally similar to how Black community does, and I think it's important that people like us are a part of the solution. And I'm going to throw this back to Jay for the final slides.
Thank you, Rocky, and also Philip and Emmett. And part of the reason that we wanted to move through this is our goal is to allow 30 or so minutes to be able to answer questions, because based on the folks that are attending today, we think that there may be opportunities for us to share information that's not on this slide. First of all, and this is just, I'm going to cover just 3 of our recommendations out of the issue brief. There are others in there. One is to create culturally adapted programs for COVID-19 vaccinations. The history has shown that vulnerable populations, and that could include ethnic populations, the disabled, aging, and a whole range of different populations, are generally the last to be able to get access to vaccinations, and particularly if there's cost structures involved. We're recommending that we try to advance this and move it towards the front. You can see that there is a very high willingness of trans and gender diverse people who would take a vaccine. That's granted that it's a vaccine that, is signed off on by the experts like Dr. Fauci and others that vouch for that. But at the same time, there's a willingness to say, let's do our part to help reduce the amount of COVID-19 in not only our county, but the state and the nation, so that we can get back to what we used to think of somewhat as normal. A second recommendation, 41% of trans people will make at least one attempt to kill themselves in their lifetime. And there's some data that shows that of that 41, another 48 will make at least 3 attempts to kill themselves as a way of escaping the pain that they're dealing with, which is not a solution for anybody. And we also know from the data that there is a fairly high percentage of trans and gender diverse people that have suicide ideation, which means that we're dealing with that as we go through every day, every week, sometimes more, sometimes less. The public health response from the state of Texas actually for suicide is very good. And it's based on, in 2016, there were 3,488 successful attempts. 3,488 people killed themselves. That's 1.5 times the suicide, 1.5 times suicides versus homicides. Texas Health and Human Services Commission and the Texas Suicide Prevention Council recommend the Columbia Suicide Severity Rating Scale. That is a much more granular scale than looking at anxiety and depression. It really starts to look at where that person is. Are they in a mode where they're thinking location, method, are they even going to write a note? And if so, what's going to be in that note? So that scale begins to uncover that. It's being employed by the local mental health authorities. And our recommendation is that clinicians in primary care, FQHCs, and hospitals begin to look at that as a method of screening for suicide intervention for, in our case, trans and gender diverse people, but we would also recommend it, beyond that. And then the last one, whoops, my slides are bumping up. 2 years ago, Dr. Sue Bornstein, who runs the Texas Primary Healthcare Summit, gave us the opportunity to have a 3-hour workshop with a panel of national people on transgender and the patient-centered medical home. We've learned a lot from that, and a lot of our colleagues nationally are implementing that and have now gained the certification for that. In Austin, Dr. Celia Neville has done a terrific job at People's Community Clinic with her adolescent program. I was fortunate enough to be involved in watching that program for several years. And so for those of you that don't know about patient-centered medical homes, you can see the diagram there. Our THI partners with Dr. Bornstein on the Texas Primary Care Summit. That would be something that any of the clinicians in this audience, I really hope that you take a look at that, because it is an important project that we're involved in, but essentially it treats the person as a person and not as an episodic illness. And so you can see the elements for patient-centered medical home on that slide. Our recommendations break down into 3 broad categories: community engagement, transgender and gender diverse inclusion, data and transparency. Each of those has a couple of recommendations in there and calls to action. I think the most important ones, they're actually all important in there, but again, thinking back to the reason that Texas Transgender Health came together starting in 2015 was to reduce and is to reduce the amount of suicide attempts and suicide ideation in the community. And so having some clear call to actions about how we can expand that, particularly into primary care, is important. The other one is, and it goes back to Rocky's point on not about us, without us. Community health workers are a proven way of being able to have people from a community help access their community members into the healthcare system. We really recommend that continuing education programs be developed. And ultimately, our hope would be that trans people are certified as community health workers, taking the 160-hour course to get certified, and then instructing in those programs. But we think that that would help in a variety of ways, particularly in healthcare settings. The other two key pieces you'll see under data and transparency. The reason that we have some estimates with Williams is because of BRFIS. The CDC measure has a sexual orientation and gender identity opt-in module. Texas, through the Department of State Health Services, has been doing that since 2015. That's important, but also beginning to look at the Ryan White funding and see how we might be able to begin using some of that to deal with trans issues. Only 1.9% of the funding for Ryan White goes towards transgender and gender diverse individuals. With that, I just really want to thank Philip and Emmett and Rocky. We've been working on a range of projects together for a while, and I could not think of four or three better people to be working with. But that is, I think, what's more important on this before we go to questions and answers is all the community members that we have been involved with and all of the allies, clinicians and frontline workers and everybody else that's been involved. This has been an important and illuminating last couple of years as we've advanced this work in bridging across different kinds of sectors. And it's important for public health and healthcare to play a role in really helping to improve the lives of transgender and gender diverse people, and then the broader LGBT plus community as well. So with that, we would love to take questions and answers. Our goal was to try to wrap up in 30 minutes. We got 31 minutes. So that gives us quite a bit of opportunity to answer questions. And it looks like there's one question right now in the Q&A, and then I'll start looking at chat. Question is, I'm particularly concerned about upcoming legislation in Texas that is attempting to limit affirming care for gender diverse people and even levy criminal charges against parents who are attempting to supply their children with evidence-based care. What advocacy opportunities are available to us in order to address these harmful health policies in the upcoming legislative session? And before Emmett, before you and Rocky take that, we should recognize our other partner in this whole project that's not in this deal is Dr. Brett Cooper, who's up at University of Texas Southwestern Medical Center. And this is the patient population that Brett works with. So that's a great question to start with. So Emmett, Rocky, thoughts?
So I deal when this Texas state legislature is in session, that is a large part of what TENT does in terms of addressing proactive proposed legislation and anti-trans legislation. The advocacy opportunities that are available, there's a coalition that we are part of. It includes Equality Texas, who is also a partner on this project, and TENT, and then ACLU of Texas, Texas Freedom Network, Lambda Legal, and Human Rights Campaign, or HRC. As the session starts to begin and we have more clarity on what is exactly happening, I think, just realistically, depending on how the elections turn out, that's going to have a major shift and impact on the appetite and movement of bills like this. But in terms of advocacy, I would highly suggest just keep your eyes out when things start to happen. I think social media, getting signed up for any updates through equalitytexas.org, transtexas.org are good places to start. And right now, I would say, yes, definitely, like, this is concerning. It's concerning that we're even having conversations that would include trying to criminalize medical providers, healthcare professionals. I think, in contrast of what we're going through, right, in the pandemic, where we laud our frontline medical professionals as heroes as they are, as they deal with this ongoing pandemic. Unfortunately, in this state, we still do anticipate to see legislation that would seek to criminalize and really unprecedentedly come in between that doctor-patient privilege that has always been kind of, a standard expectation of privacy and autonomy over one's healthcare. So I would just keep your eyes out. Like I said, it's really going to depend. We'll see in the next month how that shakes out, and then we'll have better clarity on moving forward. But thank you so much for the question.
Yeah, and one point before seeing if Rocky has any thoughts, THI is not an advocacy organization, and so we don't take an advocacy approach. But we also are involved, though, in converting evidence into action. And the current project that we have that's funded by the Patient-Centered Outcomes Research Institute, PCORI, is really to begin helping us develop research capacity that's transgender focused and led across the state of Texas. And the goal of that is to develop a research projects that actually develop the evidence data that clinicians and others can use. And so I did want to make a point that THI is not an advocacy group. And then Rocky, if you have any other thoughts, and then we have 3 more that we need to roll through questions as well, or 4 more. So Rocky, any other thoughts on Emmett's? And then I'll go to the next 4 questions.
The only addition I'll make is there's plenty of opportunities that seem small, but really make a huge difference. With the rise of social media, we see allies joining in every day to share information and get other people educated. It's a very important aspect of this work. Big and small actions really do matter every single day. That's all I have to say about that. Thank you, Jay.
Okay. The next question is, how can physicians who want to expand access to care better engage communities who do not trust the medical system? That is a terrific question. So Emmett, Rocky, and Philip, thoughts?
Wait, what was the question?
Let me go back and read it real quick. Hang on a second, it moved off. How can physicians, and we probably ought to think about not only physicians, but primary care physicians and also other clinicians who want to expand access to care, better engage communities who do not trust the medical system. And let me set up the piece. One of the things that we uncovered in our PCORI project, and this is illustrative of what it's like out there because of the lack of clinicians that trans people have the ability to go to. One particular person had to drive 200 miles each way in order to see 4 different physicians. 3 of them were located in one city, 1 in another city, and never could get the all 3 appointments in that one city together on the same day. So access to care, and particularly access to primary care, is important. So Rocky and Emmett, what are ways that physicians can begin to access? And I think one of the things that we've learned is also trans people, gender diverse people talk. So it's really the willingness of physicians, but what do you all think? How do we provide greater access to primary care?
I'll just jump in and say that the number one thing I hear community complain about is the inaccessibility, or like not ensuring that you are a safe space when they do ultimately make first connections. So number one, that starts with signaling that you're safe through programs or trainings that allow you to show that you are safe and be in continued education, so that you're not misgendering folks, your forms fit a certain guideline of best practices, and you're doing that check. And I also think that the other thing we're running into is that we need to kind of make it very clear which people have been helping our community, and kind of get everybody to that general level of continuum of care and care strategies. I just think it's maybe all over the place, so that inconsistency of deliverable care is also creating this distrust. So kind of getting people like what we're doing now, I think is a huge step in the right direction, but continuing this conversation.
And Claire actually has a point that she brought up in the chat, which is something that I think a lot of folks have wanted to see, is a doctor's website that says something like, trans patients are welcome. Yeah, that just the visual cues. Emmett, any other thoughts before we go on to the next question?
I think step one is understanding from the first person somebody sees to the last person they check out with to make their follow-up appointment, that you get your staff together, and nurses, receptionists, like anybody who's going to come in contact with an individual to get cultural education just on the very basics of being well-intentioned, because, you know, intention versus impact, right? And when you are able to do that and get people on board to just understand how to respectfully engage trans people, how to ask questions that are invasive for everybody, but may also cause a deeper level of discomfort, combined with that sort of overall community lack of trust. You know, you're going to make quick inroads there, because at the end of the day, like, the reality is that trans folks need more, you know, affirming and qualified, accepting physicians. We are clearly, you know, as you saw from the slides, we're clearly at a lack of that, and so the more offices that can be just externally, publicly accepting, but also making sure that they're doing that back end work, is really a make or break, because the trans community also, I will say, in terms of the galvanization, because we've had to kind of survive on word of mouth references given from community up until, you know, really now, and we're still making, you know, headway in that area and have ways to go. There's just kind of an unseen network of when one person, two people, three people find out in that area, you will see more patients come in seeking care, because at the end of the day, just like anybody, we want quality healthcare, we want to be respected, we want to be treated with dignity, and we want our medical issues addressed.
We've got about 10 or 12 more minutes and 4 questions, so we'll go through this pretty quickly. I just graduated this is from a person graduated from Texas University counseling program. None of the data or awareness was shared in any of our discussions. How it's not just Texas Health Institute, but all these different organizations reaching out to Texas counseling programs who train future medical health practitioners to inform these programs and encourage them to include this type of information in their curriculum. Emmett, Rocky, you want to talk a little bit about what TENT does? And Philip, do you know of anything from the academic side?
I'll just say that we constantly are reaching out to people and trying to spread the work that we do with Tent. Anything that I know of as a resource to our community, I share that through several channels, my own channels and networks, and through the networks that we've created through THI and my work with Philip, for instance, at UT. I kind of think that we've been running into a lot of barriers around why that information doesn't become paramount to training. One of those things I think, Philip, that we talked about is data. Like, people always say, well, there's no data to suggest that this community needs this. We need to train anybody for this. And I think, Philip, you did the best job of explaining to me why that was like kind of bogus. I want to throw it to you because you ain't talked either, and you're just so cute.
Thanks, Rocky. You know, I think when we think about training, and whether it's physicians, counselors, or just anybody, you know, there is a lack of curriculum on trans and gender diverse issues in healthcare. I would say that the broad spectrum of sexual orientation and gender identity, it's not there where it might be for other things. And there is, I think, a push in academic circles and academic medicine to start including this information. And I think the best place to start with that is by working with individuals from that community to get their perspective on what health providers need to learn about them and their communities, right? And I think one of the things that I've learned from Rocky and from Emmett and others on this, the projects that we work on, is this idea of emotional labor as well, which, you know, I think a lot of times healthcare providers, and, you know, they put a lot of the burden on care onto the individual, or making sense of what the individual needs, or not listening to what the individual needs and telling them they need something else. And so I do think that there is a huge gap in terms of how we could be training healthcare providers or other clinicians in terms of the needs of transgender and gender diverse individuals. And I do think that there is some movement in that space. And my hope is that, you know, folks like Rocky and Emmett will be leading those conversations, right? Or collaborating in those conversations, rather than, you know, sort of us in academia sort of taking the lead and saying, this is what we think we need to teach folks. And so my hope is that it's more of a collaborative effort in that way.
Okay, so we got about 10 more minutes. Let me toss this one out, because I think it's one that we've talked about as well. All of these are really excellent questions. Since we know that LGBTQ plus people experience a higher rate of IPV compared to cis heterosexual individuals, what would be the biggest takeaway for those organizations who are involved in intimate partner violence advocacy and want to generate a larger reach to potential transgender, gender diverse clients? Specifically, what action or actions would you suggest they take?
Partner with organizations that already have those connections into the community. They're already being told, this happened to me and I don't know where to go because I don't know where is safe. I don't know, even within these resources, if I'll be able to actually be taken seriously. I'll be actually able to find recourse, to find support, to find a way out of the situation. Another thing to note, I think that is just incredibly important, is that with Texas being the state with the highest rate of violence that ends in murder against transgender people, predominantly being Black trans women for the last 5 years running, I believe now. This issue goes hand in hand with intimate partner violence, right? In many cases, what we're understanding is, due to the stigma that has been narrated and perpetuated about our community, when this happens, it often is a result of an intimate partner acting out in terms of people finding out, or in terms of a transactional relationship with sex work. And we're understanding more and more that in these instances, they are actually also instances of intimate partner violence. And so really the quickest route, in my opinion, is to really just build relationships with organizations that are truly connected in serving and are part of the community that you're trying to include.
Let me toss this question to Rocky because of some of the work that you've been doing out without youth. The question is, hi friends, thanks so much for all the awesome data and insight. Can you speak a little bit to what the data is showing about how transgender and gender diverse youth are being differentially impacted by COVID-19? And any specific recommendations for providers, healthcare or otherwise, on how to best serve TGD children during the pandemic?
You throwing that to me?
Yep, and then Emmett or Philip, but we've got two more after that.
Yeah. Something that Philip and I have been toying around with is this idea of where we start to first notice that people are experiencing suicidal ideation or some mental health crisis. And I have proposed that some of the time where we're seeing that is between people, so trans and gender diverse people are telling each other, and that is often happening either through text-based or social media-based contracts or contacts, meaning that we should be going into these spaces and speaking directly with folks and providing resources at the source of that initial reach out for support. And what does that look like? Right now, it looks like a myriad of things that can happen. And Philip and I have been playing with a couple of ideas of bringing people together to start to create this community health worker, community ambassador program that uses members of the youth community, of the TGD community, to deliver some of these life-saving interventions, which can just be resources and a listening ear. And Philip, I'll throw it to you.
Yeah, I think, you know, specific to the COVID-19 survey and the data that we do have, when we looked at did someone have to shelter in place with someone that didn't accept them? The majority were individuals who were between the ages of 18 and 24. So it was really this young adult population. And then when we also have some qualitative data about, you know, what could be done or what's causing this. And, you know, and a lot of the folks who were in that age range also reported this disconnect from their community that supported them, that allowed them to escape kind of the experience that they're having with this person who doesn't accept them in their home. And so how do you address that in a moment when we can't go and talk or touch or be around each other without these precautions? You know, and I think it gets back to the point that Rocky made, that we need to stop thinking about bringing people to us, and we need to start thinking about how do we work with people from this community and go to the spaces where they already are. And I think, you know, some of the ideas that Rocky and Emmett and others like John have come up with are really where we should be focusing our energy, because at the end of the day, whatever interventions we come up with or however we decide we're going to support folks, we need to know that the people on the end user of this are going to be the ones using it, and how they're going to use it and why they're going to use it, so that it's an effective strategy. Otherwise, I think, you know, we're not doing much good or for anybody, I guess. And so I think, you know, to the point of COVID-19 and what can we do for children right now or young people in this moment, is I think Rocky has like one of the best brains I've ever been introduced to, by the way, but I think that Rocky's spot on with this idea of we have to try new strategies and really link in to what people are already leveraging to connect with other people. And how do we fit into that space, I think is the bigger question. And how do we build trust in order to fit into those spaces, I think is another one.
And let me then leverage into that and also toss it to any of the others. We have a really good question going back to IPV and suicide and the transgender, gender diverse community having a common thread: easy access to firearms. Is the trans community involved in advocating for reducing injury and death from firearms? There are a number of big coalitions working on this. And Philip, that goes back to the point about how do we bridge into the existing projects that you and Emmett and Rocky have already talked about. Any quick thoughts on that? And then we got two more right after that.
what was the question real quick again? I'm sorry.
Oh, it was about if we've ever thought about partnering with orgs that do firearm prevention.
Yes.
Since that's a leading cause of, I mean, it's easy
Yeah,
access.
I think
versus
of
say-
course, you know, like I don't want to make it a political conversation about Second Amendment rights or who has what, but I do think that there's clear evidence to show that individuals who have access to firearms are more likely to complete suicide or die by suicide.
Right.
And so I think it would make sense that for us to partner with, or for anybody to partner with individuals who are not, or who are also working in the space of how to store guns safely, right? Like, I don't want to get into the conversation about who or who shouldn't have what guns. If you're going to do those things, we need to figure out a way to prevent people who are having suicidal ideation from accessing those things if you want to save lives. And I think that that's my thought on it.
Let's go to this one, Emmett. It should be a quick answer. Is there a list with contact information of trusted transgender and gender diverse grassroots community-based organizations for local health departments that want to connect but don't know the organizations in their community? Or can we provide them a contact?
There's not a list that I'm aware of, but wherever you are in terms of the regional specific place, you can reach out to the email that I think we're going to provide, and I can flag if there's organizations in your area. I also want to really add that one of the things that we come into barriers, right, is when we're talking about healthcare and when we're talking about academia and we're talking about research, the barrier for entry, when you're talking about, and I think specifically there was a word that I'm so sorry, I can't, but essentially what I want to say is that because trans-led organizations, just for context so people understand, get 3 cents to every $100 that comes into LGBTQ work. So that is an enormous disparity. And so when you're talking about the obstacles of the population that already stand in place, that are limiting, that often are deterrents for getting people to a secure place or out of crisis, let alone being able to move forward, access higher ed, access housing while they're, you know, et cetera, it's all snowball, right? That then you see that also reflect in groups where you have collectives where they are more like community-based. Oftentimes they're for mutual aid or support aspects. And then you also have, you know, weighing that there are barriers, I think, created by just the system itself of like, who are we listening to and like, who are we valuing the voices of? And then when you get into like the more policy and specific kind of deep dive support, you're going to, and I don't say this in an arrogant way, but in terms of Texas, like tent's pretty much it. Just because we've worked really hard to create the infrastructure and to make sure that internally we had people continually being educated, being trained, attending, you know, continued education around the issues, as we know that, you know, we're learning more every day and we're evolving. And so I just wanted to kind of a full picture for you.
Yeah,
we're out, Rocky, we're out of time, but I do want to answer one quick question and give somebody the follow-up. Very interested in the recommendations about community health workers. Do you have any thoughts to share with organizations and individuals who are doing a particularly good job with respect to developing and implementing CHW initiatives, specifically the trans and gender diverse community? The email that we just put in on transforward@texashealthinstitute.org, if you'll bounce a note to that email, I will follow up. This is an issue that's very near and dear to my heart. And Philip, we know others, we will be happy to begin trying to figure out how to connect everybody up. with that, we're running out of time, but this would not happen, not only this webinar, but all the webinars that THI has done and all the issue briefs that we've done would not happen if we didn't have the folks behind us. Ankit Sanghavi, our exec director, is the one that really came up with this idea of how to move things forward. Nadia and Frida in our health equity group really helped us underpin some of the pieces we're here. I don't think there's a way I personally or us as a group can thank Stephanie, Andreas, Katie Bradley, Megan Talking, and Gilbert Salceda in all the work that you did to help make the brief look as fabulous as it is and this webinar go as well as it is. So thank you very, very much for all the things that you have done for us. With that, the upcoming, we've got one more webinar for THI. It's October 15th. We urge you to sign up for that one as well. It's COVID-19 in Texas, the opportunity to improve oral health system in Texas. And, you know, the one thing that I've learned, which I never knew beforehand from oral health is, you know, what happens here goes into here. So that is a very good webinar for us to be involved with. Finally, we want to thank each of you all for participating. We are excited about all of you that came here. There were several of us I know that went back and forth on chat. A lot of us are friends, and it means a lot that you are here. A lot of us hopefully will be new colleagues that we can work with. So we're really excited about all of you that showed up here. And with that, we have 1 minute left. So just a quick thank you. And if there's any other follow-up, transforward@texashealthinstitute.org is the email. We will get it to Rocky and Philip and Emmett or anyone else that needs to get it. And then the last one, please be sure if you haven't, fill out the evaluation as well as the download the issue brief. And the evaluation is in the chat. It's quick, it's painless, low burden. So it would really help us understand how we can improve things. Let's see. Yep, Philip said thanks. I think we're all saying thank you. We'll do one last thank you for the last minute. Rocky, Philip, Emmett, you want to say goodbye?
Goodbye, everybody. Goodbye.
Thank you all so much.
Thanks, everybody. This was a great time, great panel, great moderator. Thanks, everyone.